Hello student, today we will discuss about last part of oncology nursing, that is very important, treatment modalities for cancer. There are various treatment modalities are there: surgery, radiational therapy, chemotherapy, gene therapy, hormonal therapy and bone marrow transplantation. Let me see one by one. What is surgery? The doctor will operate the client. The main goal of surgery is to remove the cancer organ completely or as much as the cancer tissue. In some cases, if it is already spread, means cannot going on remove one organ after the organ. Only how much tissues, the cancer tissues possible, that much can be removed in order to reduce the burden of cancer. Surgery, sometimes the surgery is done for the diagnostic purpose also. It's called as a diagnostic surgery. Surgery for recurrence and metastasis, palliative surgery, reconstructive surgery, preventive surgery. Now let me have a look on a diagnostic surgery. Now client come to the hospital and says he got pain abdomen since long time and the scanning has taken. The inside some growth, it shows growth. Now to know that growth is cancerous or non-cancerous growth, it's required surgery. Through the doctor will operate and he will remove from that growth, will remove the biopsy. What is a biopsy? Small piece of tissue, and it is sent for the histopathology or a cytology department for the assessment of that every single cell to know the anatomical as well as the physiological changes. Say bone marrow biopsy, breast lump biopsy, excisional biopsy, endoscopy biopsy. Endoscopy means through tube insertion inside the mouth or through the anus. Colonoscopy biopsy, they will know all that. Incisional biopsy, needle biopsy. Sometimes through the needle only, the small piece of tissue will be taken and send it for the diagnostic laparoscopy, that is the opening of the abdomen. If inside the abdomen any growth is there, inside the abdomen if any abnormal fluid is collected, in order to know why that fluid is collected, is it due to the cancer, so that fluid will be sent for the study. So you can write down the notes, student. Okay, the next one is a surgery for recurrence and metastasis. See the sentence itself give the answer for us. Surgery for recurrence. Once surgery is done, the growth lump is taken out, but again the growth will reoccur without the sign of metastasis. It may not be a metastasis, but again and again the growth is appearing. So in such condition also, to remove that growth, recurrent surgery is required. Or in case of the cancer has come back with the metastasis, it spread to other parts of the body, surgery is required. Okay, palliative surgery. Palliative surgery means the client is the cancer is spread to entire body or organ. The client is in a third or fourth stage. In such cases, surgery, the doctor cannot remove all the organs, at least to to get relief from some of the symptoms and help to lead a quality of life. They will do a palliative surgery. Means surgeon perform for relief of symptoms caused by advanced cancer and improve quality of life. Example, the major symptoms is a pain itself, severe pain. In such condition, nerve block procedure to interrupt pain signals in the nervous system by implanting pain control pumps. Sometime due to the growth of cancer, the obstruction will be there. So stent placement means a large one. So at least the place will be there, whatever the flowing, it can flow properly. So, okay, the next one is a reconstructive surgery. So, what's the meaning of reconstructive? Means again constructing. Surgery done to reshape or rebuild a part of the body which is changed by previous surgery. For example, plastic surgery, breast reconstruction. If in case of breast cancer, if the total mastectomy is done, the entire complete the breast is removed, after the surgery, the woman will undergo psychologically, emotionally, she will upset. To tackle that, the prosthesis, same like breast, the prosthesis is available. Through surgery, they will place it and bring happiness in that woman. Plastic surgery, through burns or through accident or through acid victims and all, they will lose their beauty image itself. Entire the organ is crashed out. In such condition, through the plastic surgery, they will reconstruct. They will give a reshape to particular organ. Okay, what is the next one? Preventive, otherwise it is called as a prophylactic surgery. What is preventive or a prophylactic surgery? So here, removing an organ or glands that shows no sign of cancer, but more chance in future may leads transform it as a cancer. To prevent development of cancer, doctor may remove the organ. For example, fibroid uterus. Now fibroid uterus, when doctor do this, it may not be a cancer, but it again and again reoccurring, and when doctor open and see, when doctor could doubt, there is chance it may occur, reoccur, or there is more chance in the future it may turn as a cancer. So in such condition, they will remove entire like a uterus, ovary, and a fallopian tube is called as a salpingo-oophorectomy. Sometime if the polyps in colon, polyps is removed, but again and again it reoccur, it indicates that in future it may turn as a cancer. So they will do a total proctocolectomy. Prophylactic mastectomy, if lumps in a breast, but if doctors suspect it may turn as a cancer, they will remove. Complete mastectomy they will do. So that is a preventive. It is not diagnosed as a cancer, but in future it may turn as a cancer. So in order, we always tell prevention is better than a cure. So in order to prevent future complication, now itself taking the action. Okay, now is a surgical patient, nursing management of the surgical client. This is the main role of the nurses when client is undergoing for the surgery, preparing the client for the surgery. So pre-operative as well as a post-operative preparation will be there. Now before the surgery, pre-operative assessment. Assessment include history collection as well as a physical examination. Through the physical examination only the nurse will come to know various signs and symptoms. As well as the client is already posted for the surgery, it is told, doctor is already told, the day when doctor is deciding the client is posted for surgery, the preparation of the client will be started. The first one is the psychological preparation. Surgery means nobody will enter the OT happily because everyone will get scared. So to tackle that fear, psychological support, emotional support to the client as well as a family member is very important, and answering their question in a rational way. Physical preparation. In first year, fundamental of nursing, you all have studied that. When client is undergoing for the surgery, what all the preparation? Physical preparation means part preparation, where the surgery is doing and where the anesthesia is giving, like shaving the part, soap and water enema, daily bath. If the client is having the habit of smoking, drinking, gudka eating, or any other taking some other medication, no, advising the client to stop all that habits as well as taking the medication and all. So this is the physical preparation. Then physiological preparation means every system wise. So before undergoing to the major surgery, to know is it all the systems are working properly, is it in a normal condition, like cardiological examination through chest x-ray and respiratory examination, as well as every body part, and conducting various blood test, imaginary test, so to know whether client is fit for the surgery. Preparation previous night and on the day of surgery. Previous night, the anesthetist will visit the client and he will advise some of the medication, soap and water enema. So whatever he says, following that instruction is the responsibility of the nurse, as well as on the day of surgery, changing the client dress with a hospital gown, removing the denture, telling the client to have a clean bath, and removing the nails, and whatever the ornaments are there, everything will be removing, and shifting the patient to OT. So apart from this, pre-operative nursing diagnosis, when nurse do a physical examination, through the physical examination, sister will come to know various symptoms of the patient. So based on that pre-operative nursing diagnosis, you know the nursing procedure, you should have an objective, plan of action and implementation and evaluation. Okay, after the pre-operative, okay, you are shifting the patient, now surgery is over. Now post-operative preparation. What is the nurse's responsibility? Keep ready post-operative bed to receive the patient. When patient come inside the post-op, receive the patient and put him in a proper position. Bed, keep ready all the bedside article, equipments, SpO2, cardiac monitor. Then post-op assessment, checking consciousness, surgical site for any bleeding, any tubes are put, any drainage is there, whether suture lines, how many sutures are there, is it the sutures are intact or not, what procedure exactly done in the OT, is it blood transfusion is done, any complication is occurred in the OT or any specimen is sent. So entire information as well as a taking over nursing chart from a OT nurse. And doing physical examination head to foot, and according to that forming nursing diagnosis. So these are the pre as well as the post-operative nursing preparation of the patient by nurse, and this is regarding the surgery. So next we will move on a radiation therapy, that I will take in a next video. Thank you so much student. To keep in touch with my video, subscribe the channel. If any doubt or if you want to ask any question, leave the message in a comment box. If you feel this video is useful, press the like button. Thank you.